Think, Talk, Laugh is an orbital network to help you and yours navigate the healthcare system for optimal outcomes in an aging America.
If it's just like the 941, it's always a cost. The employer is the one who gets hooked up on that stuff, not the employee.
Right. Well, the two biggest affected groups by this law literally are seniors and small business.
Okay, here, you type in mine, and I'll take that.
Like me as an employer, because I'm under the 50, what is it, 40 person FTE, 40 or 50?
It's 50, it's 25. It changes as it goes into 2009.
I was very looking out there.
Len Gurian, I think is my name. And welcome to Think Talk. We're talking about what you should be thinking about. And today we're talking about the Affordable Care Act and what does it mean to you. Now you better listen because I assure you, there are two things that are really certain. We're all going to die, and sooner or later you're going to be sick.
Now it is 100% above what the original cost estimates were. So they had estimated it about $0.95 trillion. It is now at $1.9 trillion, which is almost $2 trillion.
It's always like that.
It's 100% higher. Absolutely.
The idea was that by insuring everyone, that the reimbursements to these providers, whether they be doctors or hospitals, would help pay for what is known in the industry as indigent care, those that can't afford to pay for or are uninsured.
So where's this coverage going to come from?
Well, I think that's the truth. But let's go back and say this is the grand experiment again. If you go on to Health and Human Services website today and you look at it, they'll say, we have all the data you want, but we have no analytics. Well, what are analytics? That's a way for me to basically measure what's going on. The states are in the same situation. We have all the data, but no analytics. So let's just envision a big iceberg. An iceberg, if you ever look at it, 40% is above the water, 60% is below. Well, in this case, 60% below would be all the data we don't have that we actually need to understand before we pass one of these laws.
So what do we do about it? And I've got Carly on the line who I think would like to ask a question of us regarding the solutions, the type of individual care. What's the individual role in taking care of this? Carly, welcome to Think Talk Radio.
Hi. Yeah, I do have a question. I'm young, I'm healthy, I exercise, I eat right. Is there anything in the Affordable Care Act that either incentivizes or de-incentivizes personal responsibility in your own health?
At the end of the day, we're not doing the things we should. We have to think about it from a common sense standpoint of lifestyle, better diet, and at the end of the day, we can begin to drive our costs down. 10 years ago, the CEO said, hey, this is out of control. 10 years ago, it is out of control. I'm going to put a small clinic in place, but I'm going to mandate that my people do their preventative care and take care of themselves.
Who mandated it?
They do, the employer.
The employer to the employee.
At will employment.
Right.
You want the job.
You want the job.
I was driving home a point. That's right.
Okay. Secondly, if you're diagnosed with something, you have lifestyle, you have all these other things. If you're diagnosed, we're going to educate you. We're going to give you the best care possible, but you must do what the doctor says. You must follow the instructions. If you don't, we'll educate you, and then we'll fire you if you don't do it. All right. Today, the average cost of a family program in the United States for medical care is $9,800, $9,800. Rosen's cost for getting people to do the right thing in the last decade is $2,900.
Because here's the problem. There are people of no fault of their own who have very destructive diseases or problems, and so how do you manage the subjective from the objective? And I think the only way to do that is to reinsert an individual and his or her doctor and then allow for failure to not be rewarded, i.e., if you don't follow the rules, you're not going to have the coverage, and success to be rewarded through that, which means you got to get back to individual care and responsibility and get government, frankly, in my opinion, completely out of it.
Very simply put, I talked to a state about health care, and at the end of the day, it's up to the individual, but it's also common sense.
I'm just saying goodbye because I don't know what's going on.
Oh, Daddy!
Well, we're glad you reawoke for the end of the show, Len, and we're grateful for that.
At 93, a man naps a little bit.
We're just glad you're with us here today, and we're glad you joined us here today on Think Talk.
Engage with Think, Talk, Laugh starting January 6th, 2013.